Learn all about equine teeth.
How about learning everything you need to know about equine horse teeth and why they should be regularly checked? Learn about the benefits of regular dental checks and how to keep your equine eating efficiently. Early intervention is better, and likely cheaper, than dealing with a future major dental problem. Make sure your equine is kept pain-free as they may not show any signs. Prevent the likelihood of tooth loss and other dental problems in older age. Avoid bitting problems, especially when introducing the bit to a horse, pony or donkey for the first time. It is recommended that every equine gets a dental check at least a minimum of once a year. Equines of horses, ponies, and donkeys alike are stoic animals, which means they can endure pain for long periods of time without showing any signs, especially with pain related to teeth. This could unintentionally mean that many equines could be suffering in silence. Prevention is better than cure, and identifying minor or early problems could avoid more complicated issues in the future. It's important to maintain regular dental health checks throughout your equine's life by a veterinary surgeon or a registered equine dental technician. Possible signs of equine dental issues. The early signs of dental problems are very subtle, and often the horse will not show any outward signs that anything is wrong. When horses eventually show outward signs of dental discomfort, the problem may have been developing for quite some time. These signs to look out for include a change in behavior. Drops chewed hay or hard feed out the mouth whilst chewing, pouching of feed in the cheeks, an unexplained weight loss, inflammation of the gums, redness, noticeable resistance and evasion of the bit or bridle, choke, head shaking, excessive salivation, colic, keeps refusing to eat, a discharge or smell from one or both nostrils, grinds or chews their feed on the same side of their jaw every time, head tilt or lifting of the head to help shift food to one side of the mouth, a facial swelling. Identifying undigested food in droppings or nothing noticeable at all. Amazingly, many horses show absolutely no signs of even advanced dental disorders. Signs related to ridden evasion or resistance can commonly be interpreted as bitting or tack issues. The first thought should be to check if your horse has any pain from inside the mouth. From birth, equines will shed 12 cheek teeth caps and 12 incisor caps and erupt 36 or more permanent teeth before the age of 5. This period of very dynamic change in the mouth frequently means that there could be sharp or loose teeth in the young mouth, and 6 monthly examinations is usually needed from 3 years of age 3, and usually after several years after the mouth has matured the examination becomes yearly. This will depend on the condition of teeth and jaw of each individual equine that has been assessed. By the time the equine has matured from the age of 5 years old, they can have as many as 36 to 44 teeth. Equine dentistry equipment tools. An equine dentist have different types of dental rasps, including manual and powered instruments to enable comprehensive rasping of all teeth within the mouth. Specialized tools. Here are some of the most common specialized tools used for dental maintenance that include speculums. These instruments hold open the horse's mouth during an exam, enabling visual access to the cheek teeth and allowing a more complete assessment of the oral cavity. Headlamps. The distance from a horse's lips to the cheek teeth is as long as 18 inches, therefore, headlamps are essential for a comprehensive exam. Floats. Floating, filing or rasping, is a term borrowed from masonry. Veterinary dental providers use manual and powered floats to smooth sharp enamel edges from the teeth. These instruments come in many lengths, and the type and angle of the blade are specialized for different parts of the mouth. Forceps. This tweezer-like tool pulls debris from between teeth. Dental exploration mirror. Similar to tools used for human dentistry, the oral mirror has a slightly larger head and a much longer handle. Periodontal probes. These blunt prods used for gingival exploration have markings to help measure the periodontium, tissues that surround and support the horse's teeth. Dental picks and explorers. Examiners use these instruments, which are more pointed than probes, to get a feel of the tooth and detect soft spots or open pulp chambers. Extraction devices. These include molar spreaders to break down periodontal ligament attachment, extraction forceps in a variety of shapes and sizes, and fulcrums for leverage. Wolf teeth. Considered them to be a potential cause of bitting problems. When wolf teeth are taken out, it is usually because of this historical custom of them being removed rather than due to any demonstrable problems. However, in some cases, wolf teeth can be sharp or malarupted or suspected to be associated with discomfort. A thorough examination can only be done properly by using a device called a speculum or gag, to safely keep the mouth open, in combination with a bright light. This allows the practitioner to look and feel inside the horse's mouth to check not only for sharp points but also for other problems such as ulcers, broken or missing teeth. Only once the mouth has been examined will the teeth be rasped. Many domesticated horses benefit from removal of sharp edges that cause ulcers, but excessive rounding of the teeth or smoothing of the surface will undermine the chewing function. Many horses will tolerate a brief examination of the mouth and placement of the speculum in the stable. Some horses generally tolerate rasping of the teeth very well, but in most cases, sedation enables a much more thorough examination to be done, that is done by injection with a vet in the neck, and once relaxed the dentist can get right to the back of the mouth with additional benefits of reduced pain and relaxation of the chewing muscles to make the experience more tolerable for the horse and safer for all involved. Birth defects. Development abnormalities. In equines, many cases of abnormal dental development result from exposure to poisons during pregnancy, although some are inherited. Extra teeth. Polyodontia, such as double rows of incisor teeth or extra cheek teeth, are seen occasionally. Treatment is determined on a case-by-case basis and may require extraction or frequent floating of the extra teeth. Some horses develop teeth that erupt abnormally. The most common of these is the parrot-mouthed horse that results in an overbite and wry nose syndrome when the nose is curved to one side. Severe cases can have incisor teeth that do not meet at all. While these incisor problems rarely cause the horse discomfort, the same horses often have a misalignment of the cheek teeth. Because the cheek teeth are designed to wear against each other, any unopposed tooth or part of a tooth can become overgrown. Where the rows of cheek teeth on opposing jaws are of an unequal length, large overgrowths termed as hooks can develop at the front and at the back of the mouth. On a similar note, horses are sometimes encountered which have an uneven number of teeth, due to a missing tooth or an extra tooth, and if left untreated, these can cause oral discomfort and pain when chewing. Some problems that are regularly seen are abnormal wear with sharp enamel edges on both the lower and upper cheek teeth. If pronounced, this can cause painful ulcers and erosions of the soft tissues of the cheek, or tongue overgrowth is either secondary to a misaligned jaw, parrot mouth, or as a result of a missing tooth fractured, displaced, loose or missing cheek teeth diastema, gaps between the teeth where food collects, causing gum disease. Caries, tooth decay. Tooth root abscess. Retained deciduous, baby, teeth blind, unerupted, or abnormally large or displaced wolf teeth. Abnormalities of the incisors. What are the signs? Halitosis, bad smelling breath. Quidding, dropping partially chewed food particularly over the stable door or around the feed bucket. Reduced appetite, difficulty eating or slow eating. Food packing within cheeks. Poorly digested food in droppings. Weight loss. Difficulties when ridden, such as unsteady head carriage. Unilateral, one-sided, nasal discharge. One horse dental problem can sometimes lead to another and can be more difficult to correct if not detected or treated early. Problems may need to be treated over a period of time rather than at one examination. For example, a large overgrowth will need to be reduced in stages to avoid the sensitive structures within the horse's tooth from becoming exposed. Thank you for watching this video.